How can you crack your own back? Now, we need to caveat this, it needs to be done safely and also it needs to be not detrimental for your spine long term. So today I'll show you exactly how you can release pressure on your own back and help you get into the best position long term. So my name is Dr. Jeremy Andrews. I'm a doctor of chiropractic here at West Chiropractic in Surrey, and we help people with chronic low back pain and knee pain who are looking to avoid a lifetime of painkillers and surgery. So what is the cracking in your back? When people come to see us, they always say, I want to get my back cracked because it feels amazing. Well, the cracking in the back is just a byproduct of us moving the joints back into the best position to allow the nerves to flow freely from your brain, through your spine, to your muscles, cells, organs, glands, and joints in your body. As when you move the vertebra, bone, back into place, the joint around the outside stretches and releases a gas that then pops, and that's that popping sound that you hear. So if the joint doesn't pop and it still moves back into place, that's the end product we want. Most of the time it does pop, which is what the client or the patient will hear, and then they like that and they think that's the thing that is helping them to get better. So it happens most of the time, but it's not essential for us to be getting the body into the best position long term. So let me show you exactly what we're doing when we're cracking our own back and when you shouldn't do it and when you should do it. Okay, so we're going to start off on the floor with one of these foam rollers here. This is quite a long one here. This is a Pilates type foam roller. And this is the only time that I believe that it is good to be getting any sort of cracking in your back. Okay, now they're pretty long, so you can see here, if I stand up straight, it's coming up to around my waist, and it's relatively hard as well. You can get some foam rollers where they've got some divots on the outside. I'm not adverse to those. I think they're great if you're working around the outside of the legs, the ITB, and you can also use them in your back as well. So let me start by showing you how I would use this to release pressure off my back. So you want to start with it on the floor like this. Now, I put it right up against my bum, like so. Now, I'm gonna let my back very gently just roll back like this. I'm gonna keep my knees bent, and I'm gonna put my hands behind my head like this. Now, the roller, you can see it starts around the base of my ribs, okay? So it's the bottom of my ribs here. And I'm just gonna lift my bum up, and I'm just gonna roll down like this. It's gonna go up to my shoulders. I'm just moving my feet, I'm not moving my back. So you should be able to see that pretty good. Now, when I get to this point here, I'm really trying to extend my back like that. So pulling the shoulder blades back, I'm really trying to pull the head back as well. I'm getting a nice reverse curve through my thoracic spine to extend the thoracic spine and help with that normal rounded shoulder appearance. Now, when I go back down like this, I can then start to take my hands off and put them on the side, because if you want to get it into your lower back, this can also massage the erector spinae muscles and the QL. So when on my lower back like this can be quite tender, so just be gentle. If you want to take pressure off, you can always lift your legs up like this. So in this position, I can roll from side to side very gently, and I can do a bit of pivot rolling like this as well. Now, I can also go on the other side here. If you've got sciatic pain or disc issues, you really want to be careful with this and probably not do too much rotation through the spine. And then I can start by coming back again. So again, just lifting some pressure off. Hands go behind the head, and I get all the way to the top here. Now, the cracking of your back, you're going to feel that in your thoracic spine here. As you start to get more extension, you're going to hear some pop, pop, pops. Now, as we said, it doesn't matter about the popping, but if you do like that cracking sensation, you're going to feel some through the thoracic spine. Don't want to be doing this too much though, because what happens is when we move the joints too much, we're going to get hypermobility in certain areas. So we do want to try and avoid that. I'm going to talk to you about that in a second as well. Okay, so you can see from the side here, just putting that right on the small of my back, and then I'm lifting the buttock up, rolling back down like this. Okay, and that's where you're going to hear some pops through here. So very gently pop, pop, pop. And then you can start to come down. Take the elbows off, roll them on the side. You see how my bum starts to come up? And I'm just rolling from side to side here. Taking pressure off like this. Okay, and then come back. Very gently, arms behind the head. And then really getting some extension through the spine. So that's a fantastic way that if you are desk-based or you've got round shouldered like this, it's an amazing way to reverse that position and get some extension through your chest, open up your shoulders, open up the ribs, give more capacity for your lungs to breathe as well, rather than having that hunched forward appearance like this. It's also a great way to take pressure off your lower back, as I showed you. So I'll give you an example. I went out on a bike ride yesterday with a couple of friends, and it was a quite long bike ride, a lot of climbing in it as well. And as soon as I got home, I really felt that from being in that position for 3 hours, my back had got very tight, my lower back. So I went on the roller for around 2 to 3 minutes, really helped release my back off, and that was great. But it's really important you do get some tension out of your back if you are doing exercise or long periods of endurance work, or even if you're just suffering with back pain, it's a lovely way to get some movement in the joints and help them take some pressure off those muscles as well. So some caveats: you do not want to be doing this too much, because if you start to get a lot of movement in your spine, it's going to cause something called hypermobility. So hyper being too much. Too much mobility will cause the joints to start moving around, the ligaments get lax, and that can cause more problems and pain. So you only want to be doing this for 2 to 3 minutes, 3 to 4 times a week is absolutely perfect. If you're doing it around the lower part of the back, just on the muscles, you can't do it enough on the muscles. Anything from 5 to 10 minutes on the muscles is absolutely fine. But do just pay attention when you're doing it on your joints, because that's the ones you just want to release off very gently as you go through. So if you're doing it on that mid part of your spine, the thoracic spine, I would recommend doing anything from 3 to 5 rotations through. So up and down 3 to 5 times, and do that 3 times a week will be enough to get enough relief, but also not cause too much hypermobility in your spine as well. So if you like the video, please hit the like button, subscribe to the channel for our regular updates. And of course, you can grab copies of my best-selling books here: The Secret Cure to Back Pain, How to Avoid a Lifetime of Painkillers and Surgery, and How to Transform Your Back. See you soon.